welcome our Additional Chief Secretary, Health Ma'am. And we have a Dr. Vinith from Government of India here. Ma'am, formally, ma'am, Dr. Vinith is the one who coordinates for us from the Government of India level, ma'am. He already organized a workshop at a national level, then at a regional level, where myself, Vinay, and all the AEFI committee members were participated, ma'am. Putraj is the one who coordinates for the southern states, ma'am. We have our state representative, Asha, you met her already, ma'am. So in addition to them, ma'am, we have a AEFI member where our Dr. Sarda, madam, she is our former IOG director, and she was our national member, state member for a longer time, ma'am. And also we have our Sir Raghunandan sir, Dr. Ravi, Satish, and IOG director, and your ICC Dr. Ray, are all the AEFI committee members who guide our team, ma'am. And all the DHOs are present here, including the representative from the GCC is available here, ma'am. And the entire program is coordinated by WHO and the team, and UNDP also supports this program, ma'am. So this all started because we give around 10 lakh vaccines to our antenatal mothers, roughly around 9.2 lakhs to the children from the birth till 16 years we give, ma'am. Considering the amount of vaccines which we do, we expect a little bit of adverse events. In fact, there's a global evidence that almost around 20 cases can happen, 10 to 20 cases can happen per 1 lakh vaccines given, ma'am. And in COVID also, so previously we used to do only UIP. In COVID, the same situation happened, ma'am. We have given almost 12.75 crore doses during the COVID vaccination by our team, ma'am. See, all these things we thought we need to monitor this. See, how exactly we need to monitor, what are the parameters which we need to is what our team is following up, ma'am. Mainly what we thought is, there are a few things which we should do it. That is, it could be either minor or moderate, severe, depending on the classification, whether it needs admission or whether it has gone to the level of death. See, all those things, the classification, they were already briefed. Again, in a specific the adverse events which are reported need not be related only to the vaccines. It could be because of the vaccine product, or it could be some defects in the vaccine, the components which they add, or it could be a program challenges, either because of storage or recombination or the vaccine site, the cold point. See, all those things can happen. See, by critically picking up all those challenges, we can establish that is it because of the vaccine or is because of some of the program issues that is leading to it. In this way, it will bring a confidence about the vaccine system. That's our ultimate aim. So once you are very clear that it is because of this, we can do a course correction, we can modify the way in which we administer the vaccination, but also if it is really because of the vaccine, we can do a change in the ILM. So this will bring the big confidence in the public system. That is what our thing is going to do. And all the DHOs are here. They will sensitize the team at the district level and ensure that everything is reported. See, we are very clear instruction that nothing to be hidden. You please report each and everything, whether it could be part of the UAP or outside the UAP, private vaccination, something outside your ARV also, we should start reporting, ma'am. So we'll have a bigger data on what is happening, what we should do. This is the aim, ma'am. The thing started, ma'am. Thank you very much for your presence, ma'am. Over to you for your advice, ma'am. Thank you.
Well, thank Government of India and WHO also for conducting this meeting here. I think it's everybody, as they said, I think there is a lot of learning, and I think you have kind of made them think that these are very important. Even minor AEFIs are very, very important. From a public health point of view, while all of you mentioned about that the fact that the data has to be entered, register has to be maintained. But I think for me, it's also very, very important that you maintain an absolute excellent communication with the parents, community, mothers, whom you are going to do. So it's not only about registers. I always say that the health is not about numbers. Never. The health that we provide to people is never about numbers. It's always about the quality of service that you are giving. So I think I'm very sure that you have got the training about how you need to fill the data, how you need to analyze. But I think from in a very large setup where you are actually, kind of giving, say 15 to 16 lakh doses, how do you maintain a clear communication? How do you communicate? What could be the impact? What could be the benefit? How do you make sure that you buy the confidence of people? And the second thing which I always say is that just because we deal with people who are very poor, who come to our institutions for immunization, that does not mean that they need not be told that there are, impacts, and what could be the good impact and what could be a very minor impact of the work that we are doing. I still remember during the COVID vaccination time, a beautiful protocol was followed where I personally experienced it. I was also the monitoring officer, and I could see that even at the PHC level, when you went there, before the vaccination was given to you, may not be everywhere, but I was told this is this vaccine, and maybe because of my position, but this is an ideal situation where I was told that you are being given this vaccine, and I was shown that this is the vaccine you are getting, and it has got no side effects, and it is very, very beneficial in fighting the COVID infection, and it will help you. It will develop your immunity for a period of 1 year, and it will do this, it will do that, and there can be a very minor side effect also. And then I was told, in order to check that, sit down for 5 minutes. Don't immediately leave. Sit down for 5 minutes, and then we observe you, and if nothing happens, 5 or 10 minutes, whatever may be the protocol, and then you can leave. So I was hoping to hear this also from all of you, apart from maintaining the registers and all that. It comes tomorrow. Okay, I hope you incorporate these things. But what I wanted to seriously tell you is that communication strategy is the key. Is how you communicate what you are doing, and how do you communicate how it is going to benefit is something which is going to change the entire, the perception about the vaccination. Thankfully, in a state like Tamil Nadu and in many other states in India, it has become such an acceptable practice. I still remember during the election campaign of 2014, when I was also there, a part of some teams which were from government. I was in Government of India at that time. Every time MP and MLA, they went to the local villages, and they were interacting with the local community. There was a child, the mother was holding. They were asking, have you immunized the child? Isko sui laga diya in Hindi, usi poting la. Ippo kude. Even when you go here, the collectors and MLAs and all, enna kekranga. They immediately say, they ella usi la poting la. So it has become such an acceptable practice. That is one which is a very important thing. So communication strategy has to be same. A person can be rich, a person can be poor, but there has to be a clear communication strategy that will bring you closer to your goal of better immunization. Second thing is that which is, I think some of you mentioned, that training of the paramedical staff, training of doctors on handling AEFIs. That is something which is very important. Sometimes we take these trainings very casually. We take it for granted. Operationalize your patient welfare committees, that Rogi Kalyan Samitis that you have. Immediately you should have a meeting and discuss this immunization percentage also. Find who is coming, who is not coming, and why are they not coming. You must discuss, you must inform, this is what you are doing. Discuss the mental health issues in those committees, because that's becoming very serious. Discuss about suicide. When you operationalize these district Rogi Kalyan Samitis or the patient welfare societies, you can get funding from MLA, MP, because they will know what you are doing. So anyway, this is not the forum for me to go into the details, so I will not go into those details, but we will have a separate review for that. But I think please look at how patients are being treated when they access our service. What toilets are there? Would you go and utilize those services, or your family members will utilize it? Is the toilet functioning, not functioning? Is the water there? Is the water clean? Is the water filtered? Whether the bed sheet is being cleaned or not cleaned, whether there is enough security, lighting, what is happening? Do you have proper storage for medicines? What kind of food is being provided? Your review will make it 60% better. And with a policy change regarding how do we make it more professional, will make it 95% better. And another 5% will come from what? Self-regulation. When they know that you are reviewing, when they know that you are asking questions, you will see a sea change. So this is all I wanted to mention to you, and I hope that you will think about a very good communication strategy to reach out to people about AEFIs, about immunization, about people who are getting left out, the gaps into the system. How do you talk to a local community? How do you convince people? How do you train your medical staff? How do you train your paramedics? How do you get the support of the panchayati institutions? It is not an easy task, but I must congratulate the team in Tamil Nadu, and DPH and Dr. Vinay are here for a fantastic job of immunization that they have done, which is the universal coverage, which is one of the best, I must say the best in the country. And it could not have been possible if they had not kind of involved themselves completely into it. I would also like to thank Government of India for an extremely well-functioning, I think, the largest immunization program anywhere in the world. So it could not have been possible without the logistics. I think it's a mammoth exercise, and they must get the Nobel Prize, all of you, for this. It's saving lives. Look at the kind of mortality and morbidity we used to have before the universal immunization program came in. You should present that, what it used to be before UID came and what it is now. So a kind of logistics it's a nightmare. But today we have seamless logistics. You are making sure WHO's technical support needs to be applauded, because today they have made it possible that the kind of partnership between Government of India, WHO and the state government, and especially in Tamil Nadu, this nightmare logistics, which is a nightmare, has been seamlessly kind of tuned in, so much so that even a very remote village in Nilgiri's district, without any problem, gets the vaccine on time, and it gets administered to the child. The data gets entered. So I think kudos to all the DDs and appreciation to all of you for your contribution. But we have a long way to go in other areas, which I spoke about. So once again, thank you to everybody, and I truly enjoyed coming here and interacting with you. Nandri Vanakkam.